and here it comes.
Hi, my name is Tali, and I'm a patient at Boston Children's Hospital.
She was born with spina bifida, and she has hydrocephalus, which is water accumulation in the ventricles of her brain. And she was born with bilateral club feet and bilateral hip dysplasia as well.
How you feeling? Good?
Well, the toughest thing was going through a bunch of surgeries and medical procedures and stuff. But I've learned to overcome it. Like, I can overcome anything.
Jeez, girl, you're a transfer queen.
I was really worried about you, but you are such a great healer.
Talia had this very major operation and had significant complications, actually. Some of the scariest that I've encountered, actually, in my career. She had an infection of her VP shunt, which led then to an infection of her brain.
I asked her if she was going to die, and I didn't want to even say it out loud. I don't want to think of it as a parent, but I didn't want to say it out loud, because I thought if saying it out loud, you know, was going to make it more real. And he was just like, I'm not going to let anything happen to her, no, you know, and he kept that promise.
Hi there, how are you?
These children endure multiple testing, invasive testing, multiple surgeries, and frequent ER visits, emergency surgeries, major reconstructive surgeries of the urinary tract.
He really is a driven individual. He is doing as much as he can to help as many children as possible. Dr. Estrada's organizational skills have really made the clinic into a well-oiled machine.
When we started the center, we had about 200 patients, a little less, and now we have over 700. Patients come from all over the world. What we do in the center is provide a sort of a village, so to speak, to help take care of these kids that need so very much. A good number of patients with spina bifida ultimately need bladder reconstruction. And we have been for many, many years, for decades actually, incorporating intestinal segments into the bladder. And it's an excellent solution, but it's not perfect.
This is an actual silkworm cocoon where we harvest the silk. We're able to make things as simple as a sheet that we use for bladder reconstructions, as well as the urethra.
For our patients, a solution such as this would be tremendous. It would mean a much simpler surgery with far fewer complications, short-term and long-term. It really would be an incredible advancement for these families. The reality is that families from lower socioeconomic groups have a higher incidence of spina bifida. Our mission is the same as the Milagros mission, and that is to help as many people as possible.
Big push. Today, Talia is very active. She went water skiing, she completed a mud run. Thanks to Dr. Estrada's help with the procedures that he's done with her, she's able to be more independent. So in being independent, she can do more for herself and have a fantastic future.
Fundamentally, to be entrusted with the responsibility to take care of people when they're the neediest, I think is a very special thing.